Mental health, that's like every day. NCD, non-communicable diseases as well. So currently running a campaign called Her Reason for Being that focuses on cervical cancer elimination. And we're using that campaign to ask people their reason for being in the fight against cervical cancer. So
cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll. Right, thank you very much, and welcome to the African NCD Champions Podcast, where we talk about different non-communicable diseases, experts in the space, and people working to advance messaging around various non-communicable disease issues. And today we are joined by a digital health advocate who will be talking to us a bit about her experience, what she has been doing in the space, and the different topics that she has been engaging in the digital health space. And without further ado, give us a quick introduction to yourself and what you do.
Thank you very much for having me. My name is Valerie Awuor. I'm a digital health advocate. I'm also a journalist who's very much interested in health advocacy. And I advocate on several health issues, including mental health, malaria, non-communicable diseases. And right now I'm concentrating on cervical cancer advocacy and promoting human papillomavirus vaccine uptake. Yes.
Good. So you seem to be having a large portfolio of work that you've done as an advocate. How did this journey begin for you? Where did you start from, and how did you end up being a digital health advocate?
The story is quite interesting. When I was young, I got involved in an accident, and I became sick. I was nursing the wound for a whole year. And so through that, I learned a lot about health. I learned about medicine, medication. And then people started calling me like a doctor, I'm prescribing medicine here and then. They know, everything about medicine. And then I just started developing interest on matters health, and then having also undergone several mental health issues as well. So I, from experience, so I just said, let me try and rescue more people as I did to myself. So that really helped. And studying also as a journalist also gave me a good experience to communicate well matters health. And now opportunities are just coming on that area as well. So it's like you passion meets opportunity, and everything just lines up. And so it started with malaria advocacy. That's where I started, because coming from the western region, Kisumu to be specific, having gone for those injections almost every other week from malaria, and then you keep wondering, is it possible to really do away with this disease so that we don't go for those injections again? So curiosity also came up, and that's how I found myself. And then cancer came as well, when close people around me were infected by cancer. And so that's how I also knew more about cancer, and the opportunities around cancer were just following me. So it's always been things coming up and relating to what I've gone through, what I've experienced as well.
So the universe sort of aligned to your purpose.
That's true.
I see. So what have been some of the biggest campaigns that you've been able to engage in as a digital health advocate?
Wow, so many campaigns. It started with the Zero Malaria Starts With Me campaign, which is still ongoing, and also the Power of Everyone campaign that sort of involves everyone in whatever profession you are in, wherever you are, fishermen, everyone from the village, including Mama Mboga, and you even in the city, to use your power to help in malaria elimination. So do you know you can even use your power by just using your insecticide treated nets? Using your power to prevent yourself from malaria, and that you prevent your family, people around you from malaria, so just taking the initiative, each and every person, for us to eliminate malaria. Zero malaria starts with me as well, closely related, because you can't tell other people to protect themselves and you haven't done it yourself. So you have to take initiative. When you see the symptoms, you run for medication. So such campaigns. I've also which one? Mental health, that's like every day. NCD, non-communicable diseases as well. So currently running a campaign called Her Reason for Being, that focuses on cervical cancer elimination. And we're using that campaign to ask people their reason for being in the fight against cervical cancer. So you can take an initiative to tell people that my reason for being is to inform people about cervical cancer, advise them to go for screening because early detection saves lives. Take my child, my reason for being is to be responsible as a parent. Take my child for the HPV vaccination, and through that I do weekly spaces, X spaces, formerly Twitter, discussing various issues around cervical cancer and just cancer in general and other non-communicable diseases as well. There's also campaign against trans fats, campaign to also demand for, not request, demand for the front of pack warning labels for food, so that people can make right choices as well. So it's a whole, it's really huge.
It's a mix.
It's a mix also.
Yeah. It's interesting that you mention all of these campaigns, and I'm wondering what have been some of the biggest wins that you've had having engaged in all of these different campaigns. What are some of the biggest achievements that have come your way in your work as a digital health advocate?
One of the wins that I can say I was part of is to when the malaria vaccine came, and you were among the people who were demanding for the vaccine for young people, so that you protect them at a very young age, so when they grow up their immunity is already built up well, so that they can be able to prevent themselves from malaria through that vaccine. So I can say that when we rolled out vaccine, and also expansion was done to other counties, and more will still be done. So I think that was really good for me, because people are asking, why can't you have malaria vaccine? Why can't you have that? Can really help, and at least now we have the vaccine. I can say that's really something big.
It's one of those key highlights that you're like, you add to the CV.
On matters mental health, I can just start from our workplace, and especially our conferences. I was able to advocate for inclusion of a mental health expert or a psychologist, or just someone to help when we have these conferences, and it was all about sharing our stories, our experiences, and some of them were really, really, really deep. So I really advocated for having such experts in such forums, so that when someone is maybe done with pouring out everything, that people have never even gone for counseling, therapy and all that, so they're able to get it there wherever they are, wherever they're working, and after sharing all the experiences, because sometimes it's really heavy on you. Because so I really was happy when that was implemented. So right now, if you're going for any conference, if you're going for any these travels, and it involves going there, sharing your whole story, and just remembering how traumatic it is, then you have someone to speak to after that. You have support all the time, and we are also able to employ permanently mental health expert, that at work, when you feel you're not really much okay,
there's someone to
talk to, and it's a professional, so it's worth it.
I see. What did you say are some of the biggest challenges you faced in the time that you've been a digital health advocate?
For digital health advocacy, most of the time, I just want to start by saying you speak to yourself. Sometimes you don't get that immediate response that
from the audience.
Sometimes you don't get that large audience that you expect to have. Sometimes when you're focusing on creating awareness, as I'd say, then you don't reach maybe the target that you wanted to reach. You realize that not so many people are interested in learning, checking on matters health, especially online, and also trying to reach more young people. So some of the challenges is how to engage more people, how to let people get interested in what you're doing. Advocacy takes time, and sometimes it's really hard to even measure the wins and what. So we are still patient, and as something also that I'd say, I didn't know that even in matters health there are lots of politics.
Health is very political.
Yes, I speak a lot about malaria because I'm deeply into it, and that's what I started with. So we were advocating for distribution of nets in boarding schools because we realized that there are cases of malaria that go unreported, and some students, especially in the Western and Mombasa region, they end up dying in school because of malaria. And if you check their requirements for coming to school, there is nothing written as bed nets, and the government only gives nets free of charge to families after every 3 years, and they don't give to schools. And the students stay in school because they don't want to do double distribution. I'm just saying, no, it should be compulsory for every child going to school. So I didn't know that there were lots of politics. I just
behind that.
I'm just going to speak about it, or my colleagues and I, and then the government will just listen. We've really waited.
Nothing is changing.
It's really hard. And sometimes they tell you that's not really urgent.
Yeah. Other young people who are watching or listening and want to join the digital health advocacy space, what would be your, how do they get into the space? How could you encourage them, and what are the tips that you could give them into entering the space?
For the digital space, I'd say it's really huge. It's so big. There's so many platforms you could use. There's so many opportunities out there for digital advocacy as well. And what I'd say is that when you come, as a young person, especially, I like focusing on young people because we are the leaders of today and moving
tomorrow.
forward, and tomorrow as well. So it's good to start early with the skills that you have. I'm sure almost so many young people are online at the moment, and I always wonder what are they doing online? What are they checking? They're always online. But if you just do one tweet, tobacco kills. Most of us young people in Asemekana, we are so much into drugs and all that. So what if we decide to change the narrative? Instead of now being referred as drug addicts and all that, why don't we now speak positively about health? Why don't we just do one TikTok challenge about living healthy life, away from drugs, away from the risk factors for non-communicable diseases? What if we just try to educate people about use of bed nets, the HPV vaccine, and prevention of these diseases? So I think people don't really take health so seriously, especially young people, until that time when it hits you.
Until it strikes.
It strikes, and it's really hard to start now at that time because
it has moved.
So it's really good space to be in, especially as a young person, and you really grow your skills. You meet community, you get a community online. You realize a lot can happen online. You have the power to influence change through your tweet, through your Instagram live,
your TikTok.
through your TikTok challenge, through your, they're not so much into LinkedIn, but those platforms
LinkedIn
that
posts.
I've mentioned, yeah, it's very much possible. One post a day.
Yeah, one post a day on health
On
should
health.
be something to be adopted.
Sure.
So, closing remarks. What would you say are some of the biggest takeaways that you'd want people who will watch and listen to carry with them when it comes to your experience as a digital health advocate?
I still insist that health is a really huge aspect of our lives, and without health, what can you do?
Health is the basic.
Health is the basic. Health is the basic, and I think every single person should be involved in health advocacy. It doesn't matter if it's non-communicable diseases, communicable in any other disease. So as long as you're promoting health, and not only doing it digitally, but also living
Practicing
by example,
it.
practicing what you preach, and you have the power again to influence change.
Right. Thank you very much. I think that's a very good way to bring this conversation to a close with your final statement that you actually have the power to bring change off of the efforts that you put into practice. And with that, thank you very much for coming today and for agreeing to share some of the insights from your work and life experience. And we'll see you on the next one.
Thank you very much for having me.
All right. That's a wrap.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.